is Thelma Darlene Blaylock, and today I'd like to tell you about our group project for this Nursing 404 Leadership and Management Nursing class at Murray State University. Our group consisted of Mary Sue Hubbard, Kathy Rudolph, and myself. The name of our project is Pressure Ulcer Assessment, and we chose to revise the Skin Integrity and Pressure Ulcer Risk Assessment and Management Nursing Policy at Murray-Calloway County Hospital. Our preceptor is Patricia Anderson, BSN, RN, EDS, BC, and again the clinical site was at Murray-Calloway County Hospital. Today I'm going to tell you why we chose this nursing policy to revise and discuss the first two project objectives. One reason we chose this policy is because the Joint Commission requires that hospital policies be reviewed and revised if needed a minimum of every 3 years, and this policy was up for review and revision. Mary Sue will discuss the third project objective, tell you about the Braden scale, and inform you about stage 1 and stage 2 pressure ulcers. Kathy will inform you about stage 3 and stage 4 pressure ulcers, unstageable ulcers, and a new classification, suspected deep tissue injury. She will also discuss the group's key findings, evaluation of our project, and our conclusions and our recommendations. Nosocomial or hospital-acquired pressure ulcers are not only a nationwide problem, but a worldwide problem. They are costly to healthcare organizations, painful, difficult to treat, and usually occur on areas of the body where dignity or loss of dignity is a concern. Estimated costs of hospital-acquired conditions are between $17 and $29 billion and are a leading cause of mortality and morbidity in the United States. Of that amount, hospital-acquired pressure ulcers cost about $3.5 billion annually. Beginning from October 2008, the Centers for Medicare and Medicaid Services stopped reimbursing facilities for 10 preventable hospital-acquired conditions, one of which refers to stage 3 and stage 4 pressure ulcers. That's why it's so important for nurses to be able to accurately stage pressure ulcers and perform careful skin examinations and assessments on all patients who are admitted either to acute care or long-term care facilities. Because if a stage 3 or stage 4 pressure ulcer is present on admission, then that provision won't apply and Medicare will cover the costs of treating these pressure ulcers. A study done also shows that nurses could only correctly stage pressure ulcers 56% of the time. This is a significant concern not only because of financial issues involved, but also wound treatment and patient care issues. Incorrect staging can affect third-party payer reimbursement and increase a patient's length of stay. The incidence rates of pressure ulcers in the hospital setting can be up to 65.6%, and in the nursing home setting can be up to 24%. In the nursing home, of the 24% of patients with pressure ulcers, about 25% of those patients or residents were admitted from an acute care hospital. The cost of care is more than $3 billion annually in the United States, as I mentioned before, and that's about $40,000 a patient. We identified 3 objectives for this project. Objective number 1 is that the licensed nurses will be competent to perform accurate assessments of pressure ulcers. As a result of the project, it is now mandatory that all licensed nurses in the clinical setting will be competent to perform accurate assessments of pressure ulcers. As a result of the project, it is now mandatory for all licensed nurses in the clinical setting to take an educational module on rn.com titled The World of Skin Care, Wound and Ulcer Prevention and Management, and pass the post-test. This module uses classifications defined by the National Pressure Ulcer Advisory Panel, or the NPUAP. For those of you who don't know, the NPUAP is an independent nonprofit organization. It was formed in 1987, and it's the foremost authority on pressure ulcers. It's dedicated to the prevention, management, treatment, and research of pressure ulcers. As a measurement of this objective, the target staff will complete the in-service and pass the post-test by April the 1st of 2012, and many of the nurses in the clinical setting have already taken and passed this post-test. Our second objective is to provide licensed nursing staff with an updated evidence-based policy and procedure by April the 1st of 2012. The nursing policy and procedure, entitled Skin Integrity and Pressure Ulcer Risk Assessment and Management, and all of its attachments were reviewed and revised using current evidence-based resources and approved by the appropriate committees and nursing leadership. The Braden scale was also modified using current references. The measurement of this objective was fulfilled when the revised nursing policy was approved by the Nursing Policy and Procedure Committee, on February the 8th of 2012, and by the Nursing Leadership Council and Lisa Ray, the Vice President of Patient Care Services, on February the 15th of 2012. It was then posted to Murray-Callaway County Hospital's intranet for staff use. Mary Sue will now discuss the Braden scale, present the third objective, and discuss pressure ulcer stages.
Hello, I'm Mary Sue Hubbard. The Braden scale is used with the policy that we revised. In fact, it's one of the attachments, and the criteria that's included on the Braden scale include sensory perception, moisture, activity, mobility, nutrition, friction, and shear. The highest score is 23, which that would indicate the least risk for pressure ulcer development. A score of 6 indicates the worst prognosis. Patients at risk for the development of a pressure ulcer score is less than or equal to 16. Now, the modification that we found when we did a literature review of the Braden scale tool was that there had been an age qualifier previously used, so that added weight to the score if you were a certain age or more. What we learned when we did the review was that age qualifier had been removed. So we updated our Braden scale and removed that, so now we are current with the literature. This is a picture of the Braden scale. As you can see over here, here's the parameters on the side, the sensory perception, moisture, activity, mobility, etc. And beside of each one, there's a descriptor that the nurse would select which one applies to that patient based on the assessment findings. Then for sensory perception, if it's 1 completely limited, they would put a 1 over to the far category over there in that space. And then as they rate each one based on a numerical value at the bottom, they would tally that up and come up with a total score. And as I said previously, a score of less than or equal to 16 is a patient who's at greater risk for pressure ulcer development. Objective number 3 for our group was to provide accessible resources for licensed nurses to accurately assess pressure ulcers. Our actions included creating reference cards with color pictures of pressure ulcer stages and descriptions of each. The copies of these reference cards were printed by the Murray-Callaway County Hospital print shop and distributed to all licensed nurses. The measurement of our actions was that 250 of the reference cards were distributed to licensed nurses at MCCH the week of March the 5th through the 9th, 2012. This was National Patient Safety Awareness Week, and staff were most appreciative of the reference cards. This is a picture of what the reference cards look like. As you can see, the description of the stage is over here. There is actually a picture of each stage. The cards were on 8.5 by 11 cardstock. They were designed so they could be fitted under the clipboard of the nurses' clipboards they carry with them, and they were very durable, so they could last longer. So this is what the cards actually look like. Now here's a picture of a pressure ulcer. This is a stage 1, and it's very difficult sometimes to detect the difference between a stage 1 and maybe a blemish on the skin, but that's where you have to know what the definition is. The NPUAP definition is it's a intact skin with non-blanchable redness of a localized area, usually over a bony prominence. Darkly pigmented skin may not have visible blanching. Its color may be different from the surrounding area. Further description is included in this. The area may be, when compared to the surrounding tissue, warmer or cooler, firmer or softer, painful or otherwise altered sensation, persistently red in lightly pigmented skin, or persistently red, blue, or purple in darker pigmented skin. Alright, this is a stage 2. You can see the different layers of skin here involved, and here's what it would look like on the surface. A stage 2 is defined by the NPUAP as partial thickness loss of dermis presenting as a shallow open crater with a red, pink wound bed without slough may also present as an intact or open ruptured serum-filled blister. The further description down here says the area presents as a shiny or dry ulcer with or without slough or bruising. This stage should not be used to describe either skin tears, tape burns, perineal dermatitis, maceration, or excoriation. Kathy Rudolph will now tell you about the remaining stages of the pressure ulcers.
Thank you, Mary Sue. I'm Kathy Rudolph, and I will complete tonight's presentation. Here you have a stage 3 pressure ulcer, which is defined as full thickness tissue loss. Subacute fat is involved in this, but it does not get involved with bone, tendon, muscle. Slough may be present, but does not obscure the depth of the tissue loss. It may also include undermining and tunneling. The depth of a stage 3 pressure ulcer varies by anatomical location. The reason that is some areas, like the nose, ear, and occiput, they just don't have subacute tissue in those areas. So therefore, you can have stage 3 in those areas, and it can be very shallow. This is a stage 4 pressure ulcer, and the definition of that is full thickness tissue loss with exposed bone, tendon, or muscle. Slough or eschar may be present on some parts of the wound bed. Again, undermining and tunneling are often seen here with the stage 4 pressure ulcer. And also stage 4 pressure ulcers can also vary by anatomical location. And patients are very much at risk for osteomyelitis with stage 4 because bone is involved in the other surrounding structures. This is an unstageable pressure ulcer, which is defined as full thickness tissue loss in which the base of the ulcer is covered by slough, which can be yellow, tan, gray, brown, or green, or eschar, which can be tan, brown, or black in the wound bed. Until enough slough or eschar is removed to expose the base of this type of wound, the true depth or stage really can't be determined. And the exception for that is on the heels, because eschar in the heels acts as the body's own natural cover to protect that area. And this is a picture of a new stage, new to all nurses, which is called suspected deep tissue injury. And because it is new, we did include a lot of education to the licensed staff on this stage, and did put that in the reference cards. And this one is defined as a purple or maroon localized area of discolored intact skin or a blood-filled blister due to damage of the underlying soft tissue from pressure or shear. This may be preceded by tissue that is painful, firm, mushy, boggy. It can be warmer or cooler around the adjacent tissue. Deep tissue injury may be difficult to detect in those with darkly pigmented skin. And this type of pressure ulcer may also further evolve and become covered by a thin layer of eschar. For our project, the key findings were at Murray County Hospital. We just noted that the policy was outdated, and also was the Braden scale, so we did want to revise those. And it was also not noticed, licensed staff just didn't have the resources easily available for staging guidelines, so they didn't have pictures or descriptions, so we wanted to provide that. Our evaluation was that rapport was established with necessary leaders and committees at Murray County Hospital to implement education and change. Our conclusion was that excellent cooperation and support was received from all stakeholders. Also, 90% of licensed staff has taken and passed the RN.com module and post-test. We did realize that a few days ago there was a problem with RN.com itself, so we have extended the deadline so more licensed staff can complete that test. And we've made a recommendation to Information Systems here at Murray County Hospital that they provide in the electronic medical record stages and pictures, good descriptions of those, of the pressure ulcers. Thank you.